tear, it falls and hits the ground. A tree, it falls without a sound. A bird, it calls and sends you home. A man, he sits in the cold all alone.
Hi Jay, welcome to the Joy of Sunflowers. Thank you so much for joining me. Please introduce yourself a little bit more.
Hi, thank you so much for the invite. My name is Jay. We live in England, and our journey started in 2020. We had this innocent thought that, we're pregnant first time, and it wasn't as easy as we thought from then there to now.
Yeah, it seems to be many women's stories these days. So let's start at the very beginning. Did you always know you wanted to have kids, or was it something that you sort of moved towards?
No, I always knew I wanted to have kids. So when I was at college, I always thought that when I'm 22, I'll have kids starting, and probably by now they would be already, I'm 40 now, and they would be already big. It was always my dream. And all my friends always said like, oh, I'm sure you'll be an awesome mom.
Yeah, so it's really been a dream. I'm the same. Like, I always wanted to be a mum as well. It was just like, yeah.
Yeah, and my friends always say like the way I look after people, like they can feel it, that it is on me, like mothering and looking after others. So hopefully one day we'll get there. We are working on it. I mean, we tried everything we can, and hopefully we'll get there. We're not giving up.
Yeah, so let's go from that sort of time, sort of where you realized that maybe things were going to be a bit more tricky than the sort of what we're told. You do the thing and you have the baby. Yeah.
It's just so weird, because until you are in this journey, you don't realize how many people are going through these difficulties, and also nobody talk about it. When at school they just say like, people get pregnant, they have babies, they grow the family, and that's all. So it's once I have once the first miscarriage happened, I mean, I was totally innocent. I booked the early scan, which wasn't that early. I think I booked for 9 weeks, and I started to have some bleeding around 7.5 weeks. And we went to the hospital, and I wasn't sure what was happening, because that was the first time. But I was crying so much, so they checked on me, and they could see that there was a pregnancy, but it was possibly coming out. So they sent me home, and they said, just have a rest. We'll check you again in a couple of days. And in 2 days, they said, come back. And that was confirmed miscarriage. So, but by the time I came back home, I knew it was, because it was so painful. It was very difficult, because I had no idea that was so common thing to happen to a woman. And was probably one of the most difficult times of my life, because I had no clue what to do. Did I do something? Could I prevent it to happen? So I was blaming myself. So it took me a long time to tell myself that it wasn't my fault.
Mm. Yeah, and it's amazing, isn't it? There's just so many layers to what we go through and what we have to deal with emotionally. and like they just sent you home. They didn't send you with any information or anything. They're just like,
No,
oh, go home for a couple of days and come back with
no,
no.
they said, so they said it could be a miscarriage, but go home and rest. How can you rest? How can you, yeah, you can't rest. So yeah, and when I went back, it was confirmed. So it was like I lost everything on that day. I didn't know who I was anymore, what I was going to do, how things would be, how this was happening to us. It was devastating. And then when we got back to the doctors, they were trying, well, the doctor told me, you'll be pregnant again. And it's not because it happened now, it will happen again. So chances are you'll be pregnant very soon and you'll have your baby. So it was to me, it was like, okay, and I'm trying to live the days thinking that, okay, it happened once, it won't happen again.
Yeah, that's the thing that shocks a lot of us, I think, especially with reoccurrent like loss. You're told, oh, it was just a fluke. It was just like, it was probably chromosomal. Like we don't know what it was, but just keep trying.
That's exactly, keep trying, and the chances are that you will have your family very soon.
So how were your emotions during that first loss? Like after you had the loss, and obviously shock, because they sort of just sent you home and were like, yeah, we'll come back in a couple of days, and then sort of confirmed it. So how did you go with the emotions?
It was very difficult. I had a couple of times panic attacks. It was very difficult for my husband to try and help me, because then I came home and I passed the fetus. So I'm there trying to rescue it and keep it in a little pot because I wanted to take it to the hospital. And when I saw it, I went completely crazy. Like I think I don't even know how to explain the sensation, but it's like I was out of my body and back, and my husband trying to control me. And all I wanted was just to hold on to this because that was the only thing left. And then we took it to the hospital to so try and see if they could investigate something. All came back normal, and we never found out what was the reason of the, I mean, I think we will never know what happened. And I think that's the majority of the cases for most of the women. You don't know what is causing this. I mean, we have so many investigations and things. I mean, we kind of like have a clue what could be, but we still don't know for sure what it is. And I assume for most of the women is the same.
Yeah, definitely. I mean, from the women I've spoken to anyway, like there are a lot of women who just don't have answers, and they probably won't ever get those answers. I definitely didn't. I didn't actually know that I could take the baby if I passed it. I had a sac, so I didn't know I could take that to the hospital or to the doctors, like to get it tested. So I never did that. So yeah, I don't have any chance of getting answers for that loss. But
and that's because we don't have nobody give you the information. So there's no much information on case like this, and you don't know. I didn't know what to do. I just thought if I can get any answer, I want to get it. And unfortunately there was nothing for that one, for the first one.
Yeah. So moving on from there, obviously you were told to, we'll try again. So how did that go the next time?
So obviously we waited a little bit, and everybody my friends kept on saying you should, recover yourself first. But when do you recover? When are you ready for it? I mean, your body, maybe there is a timeline, but in your mind, you will never forget it. I will never forget what happened. Especially, it wasn't just that one time. But I wanted to see the doctors and I wanted to have answers, but nobody gave me anything. So after a couple of months, we start trying again, and then we fell pregnant again. And then there was another miscarriage. And that was a little bit earlier than that. But because of what happened, we booked a scan earlier. So I booked a scan for 6 weeks. So we were driving to our first scan, because for the first pregnancy, I started to bleed before the scan. So we went to the scan, and when they were doing the scan, they said, I could see on his face there was something not right. And he said, because we went to like a private scan, so he just said, I need to refer you guys to see the hospital, because it's not how it should be for 6 weeks. And then we went to the hospital. It took us some time. They were not sure exactly, but we had to wait a couple of days, and then I started to bleed, and then another miscarriage, unexplained. That was too early. We couldn't investigate anything, so we don't know what happened for this one. And then not long after that, after that, the second one, I just said, okay, we're not going to wait. We're going to start trying, because I didn't want to give myself time to think about anything or try to find answers or any of this. I just said, right, we want to have a family. We'll just go for it and we'll try again. In my head, I thought, okay, that's it. It happened twice. Now it will be our time. And then we fell pregnant again, and there was another miscarriage, unexplained and very early, and so even more painful, because I just thought in my head, it's not possible that someone will have 3 recurrent miscarriages. That's not possible. But it happened again, and every time it's getting more difficult to, what do we do now? What we can do differently? What are we doing wrong? So doctors couldn't give us any answer, and then we started to try and get more tests, but on the system in England, as you probably know, there are some tests that they don't do.
Mm-hmm.
So we started to investigate what we could do to get those tests that we couldn't do on the NHS. And that's when it starts getting more difficult, because people around you they want to help you, but they don't know what to say, and everybody kept on saying me, you should go and try IVF. But we were getting pregnant. We got pregnant 3 times, quite fast, I would say. And the doctors kept on saying, just keep on trying. Now it happened 3 times. It probably won't happen again. You will get your baby.
Yeah. I hear that a lot as well. Keep trying, keep going, it will happen. You can't have this many losses in a row, and it's like, well, then why are there so many of us?
Yeah. I just don't understand why the system, I don't know how it is where you live, but here, I mean, also it's frustrating when you hear the answer, oh, because of your age, we can do that for you. Like, even if you would like to try to have to go the IVF route on the NHS, we wouldn't be able to because of my age. I mean, there is some places in UK which I think is not acceptable at all. Some addresses, because this, I don't know, it's like a lottery. You know, some areas in UK, they do it until you're 42. Some areas, they do it until you're 40. And in the area where I live, it's 36. So I would have to move my address, live somewhere else, then I probably I would have another 2 years to try. But there is no guarantees that IVF could help us, because we got pregnant 8 times.
Wow.
So at the moment we are on 8 miscarriages, and one of them in September 2021, we were pregnant and we were about to go on holiday, and I was thinking, shall we just cancel everything, because if we fly, maybe something will happen. And the doctor said, don't be silly, go and enjoy your holiday, relax, everything will be fine. Flying is not a problem. Flying is not causing miscarriage. So I thought, okay, we go on our holiday, we will enjoy it with the baby, and hopefully everything will be fine. So we went to my country, we went to see my doctor, we could see the heart of the baby. I mean, we couldn't hear, we could see flickering of the heart, and it was magical. It was really, we were really happy. And then coming back after our holidays, we were in Spain then, and we went for a walk. So we were staying a week in Spain before coming back to England, and I felt something wasn't right. So we went to the hospital to check. I was bleeding already, and when they did the scan, they said there is no heartbeat. Again, we were 8.5 weeks, and so I decided at this time I wanted them to see if there was any investigation they could do, and they said, okay, we can do that. So they sent it for analysis, and it was a girl. They could see it was a girl, and she had 1 extra chromosome. So when I got the results back, I started to panic, because I thought there is something wrong with me, that I'm giving my babies an extra chromosome, and that's why I'm having all of those miscarriages. And then the doctor said, no, this is one off, because we've been tested, me and my husband. So we had DNA tests, and they checked for incompatibility as well, and it was all normal. So that was probably one off. That's what the doctor said. And then since then we had a couple of other miscarriages very early, like 4.5 weeks and 5 weeks, and there was we don't know what was why it happened. So there is only one we know I miscarried, because it was the baby had 1 extra chromosome, we wouldn't survive anyway. That's what they said.
Yeah. And it doesn't help you any when they say, oh, it's probably just this one. There's not, like, the other ones, probably not. It's so rare, and I always find that very confronting. Like, it's just like, that's not helpful.
No. So only in 2022 July, after the miscarriage I had in June, I said to my husband, we need to go and do something. I mean, I don't want to be waiting for the UK system to help us, or see what the doctors can do, which type of exams they can do and tests. I mean, I want to go to the bottom of it and see if there is something more we can do, or which different types of tests we can do. And I started to read a lot about which doctor we could see and where we could go and who could help us. I mean, I was just desperate. I wanted to do something and go to someone that could give me answers and would be keen to help us. Because with the NHS, I just felt like, every time you go for an appointment, it's 3 months wait or more. And then I was about to be 40, and I don't want to be sitting waiting while I can get pregnant again and lose another baby with no answers. I mean, like, if there is anything I can take to help, I'll just do it. But I need to know, and I need a doctor to prescribe it for me. So that's when we decided to go and see a private doctor, and we have multiple investigations and tests and difference, and it was confirmed that I have natural killer cells activity elevated. Also was discovered that my thyroid is working in a different way, so I'm on levothyroxine. Then they put me on hydroxychloroquine and steroids and aspirin. So we're trying everything we possibly can. And my husband also had some tests done, and he was advised to change his supplements, diet. So that was good. We got good results for him after 3 months. And so then we got cleared to try again, and we got pregnant in October 2022 again. That was the 8th time. And I thought, now we are covered, because we are taking all this medication, steroids, aspirin, and we're seeing this doctor who is looking after us. We got better in lots of aspects, changed our diet, exercising, and you always hope that this, then we did all these changes, and now it's going to happen. And it was Halloween. We went out. We went for a weekend away with some friends. I mean, very early we shared the news with them, because we couldn't keep it. And the day after we got home, I started to feel a little bit weird back pain, and I went to see the doctor, and it was another miscarriage. So that was the first miscarriage we had under the private doctor. And only after this miscarriage, he said, "Oh, there is something else we can try. So we will prescribe you that, and the next time you're pregnant, you will try." And we haven't been pregnant since. So we don't know. We have this extra medication now, but we don't know if it would work, because we haven't been pregnant since.
Gosh. Well, I'm so sorry that's been your journey. That's quite a lot of loss and a lot to deal with.
Yeah, it's very difficult, and it's difficult also because you don't. I mean, I finally found a community where I can talk to a lot of women who has been or is going through the same, but it's been very lonely journey from beginning. I mean, it's only been 4 months since I started to talk with all these women, but it's been very lonely journey, because your friends doesn't really understand what you're going through. I mean, they try, and as much as you explain, it's just not easy for them to understand, and I do get that, but it doesn't change how I feel about it, or how all the women feel about it, because it is really painful and frustrating when you're trying all you can with all your power to get there, and your body just doesn't listen, doesn't do what it's supposed to do.
Yeah, and I mean, I think as women, we have that clock that we feel ticking, and that is something that makes it harder, like especially if you are older and you're still dealing with that clock, and you're like, I don't know when I'm going to hit premenopause and go through that. And so there's a lot of layers that come with being older and having to deal with infertility.
Yeah. And I mean, there's a lot of pressure as well. I put a lot of pressure on me, and I think that's normal for every woman, but the outside world also puts pressure on you. Like, people ask, when you guys going to have a baby, when is the baby coming? So things like this, it is not easy.
No.
As you know.
Yeah. How have you gone with that emotionally? I mean, you've had 8 losses, so how have you continued? Like, how are you in your mind, continuing to try?
Every time it happens, in a very short time, I go through phases unconsciously. First thing, I want to dig and investigate everything, and I start to read about so many things, and I want to try everything. and then it came to my mind a couple of times, like, what am I doing? Am I trying it so hard that is not happening? Do I have to just forget about it? How do you do it? How do you forget about it? And then I just keep going this way. Okay, as soon as the new CD1 comes, I start to think, okay, so that's a new beginning, and something just inside me just motivate me to go for it again, and try to be positive, and we just go for it and try again. It's not easy, but there is something inside of me that just say, you can't stop. As much as I'm tired, my body is tired, my mind is tired, but we will continue, and I'm hoping that we will get there, and all what we did and we do will be worth, because we want to have our family, and we want to get there. So it has to be a way, and hopefully we are soon to get there.
Yeah, I think as well, like, everyone has their limits, and you're not at that door. Like, you're going, so yeah.
I have to say that a couple of times I thought, like, do I need to stop it, or is it time? But that's not what my body is saying and what my mind is telling me. So somehow I have lots of power to continue, and I have an incredible partner as well. My husband has been my rock, and then we'll keep going.
Yeah, no, it's always good when your partner is on board and is there and is supportive in that, because it is a hard journey, just going through it.
I mean, I have amazing friends as well. It's just sometimes I think I make it more difficult for myself, because some things I just think, what's the point of sharing if they don't understand? So I share a little bit. Sometimes I share too much, but then sometimes I just go, I just don't want to say anything. Like, Mother's Day was a really difficult day. Especially because I had to test on Mother's Day, because we were trying, and just by coincidence the doctor said, okay, so on CD24 you can test. And I was checking, oh my god, that would be Mother's Day. Shall I just leave it and test the day after? Shall I test one day earlier? And then I thought, no, but I have to test on the day that I have to test, because I have to know I need to stop medication, continue medication. And yeah, it was negative. So it was very difficult and frustrating. Another year, Mother's Day, and we still have empty hands.
Yeah. So what's the plan now? Just continue to try naturally and see where you go from here?
So we tried, so last cycle was a medicated cycle. We're trying for super ovulation. That was the first time we tried. And I think that's why I was so hopeful, because we had a scan before the ovulation, and a scan was perfect. Everything was looking perfect. Yeah, everything looked fine. We had the trigger shot, and we didn't get pregnant. So we will try again this month, and hopefully that will be our time. But we've been thinking about trying something different. The problem is for us, because of my immune system, what the doctor told us is he doesn't think that IVF would be much of a help for us, in the sense of, if we have problems with the implantation, how could IVF help us? But it would at least give us a chance to have a better quality embryo. I mean, they would choose the best ones and try that. And because we haven't we didn't get pregnant since we've been offered this new medication with this Neupogen filgrastim, GCSF. I've heard lots of women had good results with it, but we need to fall pregnant to try it. So that's what we will try. So we'll try super ovulation again, and then we have to talk to our doctor and see what will be his advice after that. Would he then tell us, maybe let's try IVF after that or not? I'm not sure, because when we spoken to him about trying IVF, he said if you have implantation problem, we wouldn't really advise you to go to IVF yet. So yeah, we all we know is that we will try super ovulation again. So, and then we need to hope that that would work. If not, we need to get the advice from the doctor and see what he will want to try next.
Yeah. I mean that's a really hard sort of thing to be working around, that problem with the immune sort of system like that. Yeah, I don't know how you would go around that. I mean, I've learned a lot about IVF just doing this event, and yeah, I wouldn't think that would be the best route to go in terms of that specific issue, if that is what's stopping the babies from actually like being solidly in the uterus.
Yeah.
Gosh, that's like, yeah, I'm just like, I'm trying to search for answers for you. Like,
what can I do? What can I do?
Yeah,
I wish someone.
Yeah.
Sorry.
Oh no, you go.
I wish someone could just give me the answer. You have to do this. I would certainly do it. Well, we've been doing everything that the doctors advise us, and yeah, I'm just hoping that we will eventually get there. I mean, we've been seeing so many women getting their rainbow baby, and we just dream that we will be next.
Yeah, the only thing I can think of is like, you know, you do IVF as in to get the egg and the sperm, the embryo.
The best part, yeah.
Yeah, and then you get like a surrogate that then carries the baby for you. Because I've heard some successes with surrogacy. But obviously surrogacy, even with surrogacy, you can still have a loss. So I've actually spoken to some women who have had surrogates and did actually have a loss, and then they had the rainbow through the surrogate as well. So that's still something to consider as well. Like, it's not just, oh, it'll work. Things can still happen.
Yeah, there's no guarantees in any route you go.
Yeah.
I mean, I've been, nobody really say anything to my husband. People just tell me things, but I've been like, I think this past week, I've been asked about adoption at least 5 times. Like, have you guys thought about it? And I just said, like, we are not there yet. So I'm 40, and there is lots of options we can go through still. So we will try that.
Yeah, no,
first.
I
Yeah.
actually just came off a call with a lady who was saying about adoption and how, like, that's the go-to that everyone sort of comes out with and is like, oh, why don't you just adopt? And she's like, because not everyone can. She was like, I don't even qualify right now. So
I wouldn't know, like, even how to start for it, but I know that in UK it's not that easy as well.
yeah, no, I don't think it is easy anywhere. The lady I was speaking to is in America. I'm in Australia, and I can tell you the adoption process here is really convoluted. It's very hard to adopt here in terms of adopting within the country. But if
Yeah.
you've got more money, you can adopt internationally. But even with that, there's like a whole load of problems. And like, yeah, I don't think
Yeah.
I qualify anyway. But
Yeah.
last time I checked, we didn't qualify. So yeah,
Oh my God.
yeah, amazing, isn't
Funny,
it?
not funny.
Like, you want to have kids, you're like really passionate about it, and then you don't even qualify to like be that, like, a mother to someone who needs one.
Yeah.
Like,
I thought about fostering, I don't know if you guys have that there.
yeah, we have
Probably.
fostering.
Yeah.
In
Yeah.
fact, it's a bigger thing than adoption over here, because there was like a whole thing, like political thing, something that happened in our history in Australia. I won't go into it because it's really full on, but
Yeah.
yeah, fostering seems to be like the main thing that they do here.
Yeah. I thought about it, but then to think about you looking after a kid, I mean, it could be a small kid or a teenager, and then they can go any minute. So it's heartbreaking as well. So it's not, I think, yeah, it would make me very sad if that would happen.
Yeah, I mean, you like, I mean, the way you would probably have to think about it is you've got this child, you've got, X amount of time to impact their lives. You don't know how long,
Yeah.
and you
Yeah.
can be a solid foundation for them to land
Yeah.
however long you have them. But that's,
Yeah.
yeah, I couldn't do it.
No, I think because of the journey we've been through, I mean, I want to be a mother, and I want to have a child that I know they will be there. I mean, we don't know, life is unpredictable, but yeah, I think I would just put me on more suffer than what we've been already with our journey. So yeah, I just hope that all our actions and all what we've been trying will give us our rainbow one day, and that what stops me to stop.
Yeah, I have one
If
of
that
my
will happen.
Yeah, one of my speakers said she's not going to stop until someone tells her she physically can't anymore. And I was like, fair enough.
Yeah, I think there is something that just keeps me going, and I'm happy that it's there, because I think it would be really sad to just give up. I normally don't give up on things I want.
Yeah, I mean, I think there's lots of different ways to look at it. Some people say giving up, and some people just say, I'm shutting a door and I'm going through another one. Like I'm choosing
Yeah,
to go a different path than the path
yeah,
I was on. And I think it's, you've just got to go with whatever it is that is pulling you. You're obviously being pulled to continue. So
yeah.
that is something that you obviously need to do.
Please note that all speakers, including experts and professionals, express information, views, and opinions that should not be used to diagnose, treat, cure, or prevent any medical conditions. If you have a medical issue, please consult a qualified professional. Speakers voice their own views, opinions, and conclusions, and they may not reflect the views, opinions, and conclusions of other speakers. Ella Rose, The Joy of Sunflowers, and its sponsors may not endorse all or any of the views, opinions, or conclusions expressed.